Good morning, everyone. Bonjour tout le monde. The press conference with Green Party Leader Annamie Paul will now begin. La conférence de presse avec la chef du Parti Vert va maintenant commencer.
Good morning, everyone. Bonjour tout le monde. D'abord, quelques remarques sur l'annonce du gouvernement aujourd'hui en ce qui concerne les nouvelles mesures concernant les armes à feu afin de combattre la criminalité. Bon, les armes à feu, on va les laisser là. First, just a couple of remarks with respect to the government's announcement today on firearms. We are still unpacking the announcement from today, and we are looking forward to reading the fine print. As we know, the fine print is where all of the important details are going to be. There are certain things that we see in there that we welcome. We welcome an increased ban on a number of different classes and categories of firearms. We welcome the commitment to work with municipalities who are seeking to ban handguns within their territories. And we welcome the strengthening of border services measures. With that, though, there are some things that we do want to underline, and again, we're looking forward to seeing more detail about them. First, we have to say that we have been and we remain opposed to mandatory minimum sentences. We do not support them in this context or in general. We know that there have been and will continue to be unintended consequences of such mandatory minimums. We know that racialized communities and indigenous communities are disproportionately impacted by mandatory minimum sentences, that systemic discrimination and racism continues to exist in our criminal justice system. And without an even playing field and without even a sentencing and arrests in the first place, criminal charges in the first place, any kind of mandatory minimum absolutely risks disproportionately impacting already disproportionately impacted communities. We want to see the discretion where it should be, and that is in the hands of well-trained judges. We also know that the overwhelming majority of crimes committed with a firearm are committed with firearms that have been illegally obtained. One of the main weaknesses in our existing legislation and our practices is that it does not sufficiently focus on our border services and on preventing illegal weapons from being smuggled across our frontiers. So we will be looking to hear exactly what is being proposed in terms of reinforcing those services. Alors, dans les nouvelles mesures qui ont été annoncées aujourd'hui sur les armes de feu, c'est une bonne nouvelle de savoir que le gouvernement veut travailler avec les municipalités qui veulent interdire les armes de poing dans leur territoire. C'est une bonne nouvelle de savoir que le gouvernement cherche à renforcer notre agence de services frontaliers pour combattre l'importation illégale d'armes au feu, parce que nous sachons que la plupart des crimes qui sont commis avec des armes à feu sont commis avec des armes à feu qui ont été obtenues sans un permis. Alors, si on veut combattre les crimes associés avec les armes à feu, il faut absolument assurer que nos agences de services frontaliers ont les soutiens nécessaires. Nous sommes complètement contre l'alourdissement des sanctions pénales minimum, exactement parce que nous sachons que notre système de justice criminelle est encore un système où il y a des problèmes structurels, des problèmes de racisme systémique et qu'il y a un impact disproportionnel sur des communautés comme les communautés noires, comme les communautés autochtones. Alors, on veut que que la décision sur les sanctions pénales soit dans les mains des juges bien formés qui seront capables d'adjuger que serait le propre sanction pénale pour ce type de crime et pour toutes les autres catégories de crimes d'ailleurs. Et oui, alors nous allons regarder pour voir les détails, mais c'était quelques points à soutenir directement après ces nouvelles d'aujourd'hui. And then moving to the second theme, which is the latest recommendations, the recently released recommendations of the National Advisory Committee on Immunization, or NACI. We wanted to take this opportunity to say that we certainly hope that the lessons that we have learned in such a painful and hard way during this pandemic will not be forgotten as we go forward, and that as we can incorporate those lessons learned to make better decisions going forward, that we will not hesitate. I wanted to congratulate NACI for and welcome their recommendation that adults from racialized communities that have been disproportionately affected by COVID-19 should be prioritized in the second stage of shots. That is a decision, as they said, which was guided by equitable, ethical, and efficient allocation of COVID vaccines, and to ensure that given that some populations will need to be vaccinated first, as we are going to have a staggered vaccine supply, those communities are included. And it is so important now to make sure that the Prime Minister works with his provincial counterparts to respect that recommendation, to encourage them to respect that recommendation, because we know that racialized communities around the country have been disproportionately affected. Here in Toronto, where I am, we know that 79% of the cases of infection were within racialized communities. And as recently as last summer, 1/3 of all cases were within the Black community alone. And so we hope that we will see all of our provinces committing immediately to respecting this particular recommendation so that a community that has been disproportionately impacted can have relief as soon as possible. Alors, nous voulons reconnaître la recommandation du Comité consultatif national de l'immunisation et leur recommandation que les adultes des communautés racisées et marginalisées touchés de manière disproportionnée par le COVID soient vaccinés dans la deuxième étape des vaccinations. On reconnaît aussi que c'est une recommandation basée sur des données probantes et aussi les questions liées à l'éthique, l'équité et la faisabilité et l'acceptabilité de qui devrait recevoir les vaccins comme priorité. Et on appelle maintenant au Premier ministre de travailler d'une manière directe et urgente avec les provinces pour organiser un système, un protocole pour assurer que ces adultes des communautés racisées et marginalisées touchés par le COVID-19 soient vaccinés le plus tôt possible dans le deuxième stage et que cette recommandation de nos experts du panel CCNI soit respectée. Et avec ça, je peux prendre des questions. With that, I'm happy to take questions.
Thank you. We will now begin with questions. One question, one follow-up. Nous allons commencer avec une question, un suivi. Please use the raised hand feature if you wish to ask a question. Veuillez utiliser la fonction de lever la main si vous voulez poser une question. Are there any questions? Est-ce qu'il y a des questions? Oh, oui. Un moment. Okay. The man from the Canadian Press has a question. Go ahead, Matt.
Hello, Ms. Paul. Thank you for making time for this. I want to ask, you said like the Prime Minister Justin Trudeau should work with provinces to make sure they follow the NACI recommendation and prioritize racialized adults. what tools maybe you think the Prime Minister would have to maybe put pressure on some provinces, maybe, or to maybe convince them to follow these recommendations?
Well, first, more than anything, the Green Party has been calling for many months now for an intergovernmental rapid response task force on COVID to ensure that we have a coordinated, unified national response that respects the science, that respects the recommendations of the experts. As we know, our neighbors to the south have that now. President Biden instituted that national coordination rapid response facility on his first day in office, and we still lack it here. The Prime Minister certainly has the moral authority of being the Prime Minister that he can use in order to urge all of the provinces to respect this recommendation. This is a guideline, as I said, that is based in science, that takes into account all questions of efficiency, of ethics, and also of what will best protect the entire population, because we know that members of racialized groups often tend to be doing the kind of work that requires them to be out within the community. We know that they are more likely to live in unaffordable, compressed housing. We know that the rates of infection are much, much higher, and that is a risk to the entire community. And so the Prime Minister should be working to get assurances from his provincial counterparts that they will, in fact, respect this scientific guideline in the best interests of all people in Canada. He has been reluctant to implement any firmer measures. I'm hoping that this recommendation is sufficient to get the action. We haven't heard any provinces step forward to say that they do plan to respect this guideline, but I certainly hope that we will be hearing that today and in the days to come, so that they can prepare and make sure that those communities are vaccinated as a matter of priority in the next stage.
Thank you. The NDP is calling on the federal government to get involved directly in setting up vaccination centers. I believe you heard of this call this morning. What are your thoughts on this? Do you think the federal government should get involved by using maybe the military or other assets that the feds have to make sure delivering vaccines or the rollout is not, like to ramp up the rollout of vaccination as we move forward to with more, with more shots available from Pfizer and Moderna?
So I come back to what I said before, which is that all along we should have had a unified, coordinated national response. This is a national pandemic. This is a matter of national security. Of course, the federal government should be involved at every stage in leading the response. The Prime Minister should have, and we continue to call for him to convene that permanent intergovernmental task force that would be able to provide that rapid response, that would be able to look at every single aspect of our COVID-19 response, and where any aspect would benefit from a unified, a nationally coordinated response to do that. And we have seen time and time again what the lack of such a rapid response task force has caused in terms of mixed messages, in terms of lack of coordinated distribution and delivery, in terms of delays in getting people vaccinated. And so as we prepare for this, the deliveries of vaccinations that we are expecting beginning intensively in March and in April, we know that the provinces are almost certainly going to need additional support so that we can ensure people are vaccinated as quickly as possible and as efficiently as possible. There is no question the government has a role to play in that beyond just delivering the vaccines themselves. And so once again, there is the opportunity to convene that rapid response task force, as they have in the United States, to ensure that people get vaccinated as quickly and efficiently as possible. I will point out what I think we all know at this point, but it's worth remembering. The United States also has a division of power. Public health and health is reserved for the states, but that did not stop the President of the United States from creating a national task force, from creating a COVID rapid response team and having a COVID rapid response coordinator. So we also should not hesitate to do that at the federal level. It's the kind of leadership that is required.
Thank you very much.
Thank you.
Thank you. Are there any more questions, please? Est-ce qu'il y a d'autres questions, s'il vous plaît? No further questions? This will conclude this press conference. Thank you for attending. Merci. Ça termine la conférence de presse. Merci beaucoup et bonne journée.
Thank you very much. Bonjour.